Hi, I'm Christina, Ashley Regional Medical Center's stroke coordinator. Did you know that Ashley Regional is designated as a stroke receiving facility through the Utah Department of Health? Today we're going to talk about early stroke care and hands-only CPR to help you save a life. Our brain is responsible for many bodily functions: our memory, learning, speech, personality, hearing, vision, sense of touch, mobility, and more. A stroke can be deadly and debilitating. Stroke survivors have a 50% chance of being chronically disabled. There are two main types of strokes that interrupt or reduce blood flow to brain tissue, causing brain cell death within minutes. 87% are ischemic strokes, where blood vessels are narrowed or blocked due to blood clots or fatty deposits. The second main type is hemorrhagic strokes, occurring when a blood vessel in your brain leaks or ruptures. This bleeding causes swelling and compression of brain tissue. Possible causes include high blood pressure, trauma, illicit drugs, and aneurysms. Stroke and cerebral vascular disease are the second leading cause of death worldwide, with 15 million strokes occurring yearly. This means 1 in 4 people will experience a stroke in their lifetime. There are factors that increase your risk of having a stroke. Some are out of your control, including race, age, gender, and family history. Other risk factors can be prevented, including cigarette smoking, alcohol abuse, stimulant use, high blood pressure, heart disease, diabetes, clotting disorders, high cholesterol, obesity, and head trauma. Preeclampsia and hormonal contraceptives, combined with other factors, also increase the risk of having a stroke. Strokes are deadly and debilitating. Patients who arrive at the emergency room within 3 hours of the first sign and symptoms have greater chance of survival and less chance of disability. Our skilled physicians have direct contact with neurology at the University of Utah and can administer a clot buster if appropriate. To detect a stroke, remember the F.A.S.T acronym. F is for facial drooping. Does one side of the face droop or is it numb? Ask the person to smile. Is it uneven? A is for arm weakness. Is one arm weak or numb? Ask the person to raise both arms. Does one arm drift or not move? S is for speech difficulty. Is speech slurred? Ask them to repeat a simple phrase. Is there difficulty speaking or understanding words? T is for time. It's time to call 911. Other symptoms of a stroke can include weakness, numbness, difficulty walking, confusion, difficulty seeing, severe headache, and dizziness. Hands-only CPR has shown to be effective as conventional CPR and only has 2 steps. Number 1, if you see a person collapse or become unresponsive, call 911. Number 2, perform chest compressions until help arrives. Jake, a paramedic from Gold Cross, will now demonstrate this.
Place the heel of your hand in the center of their chest. Interlace your fingers. Keep your arms straight with your shoulders over your hands. Push hard and fast to the beat of a familiar song like Staying Alive that has 100 to 120 beats per minute. Compress the chest at least 2 inches and allow the chest to rise completely before pushing down again. For infants and children, CPR with compressions and rescue breaths is recommended, including victims of drowning, overdose, and breathing problems. To take a local CPR or first aid class, call Gold Cross Ambulance at 435-789-6907.
Thank you for watching and helping save a life.